Hello everybody, this is the first voiceover for the breast disorders content, and it will cover benign disorders of the breast. You will want to review the normal anatomy and physiology of a breast. This slide includes the screening guidelines for women. Women aged 40 years and older should receive an annual mammogram as well as annual clinical breast examination. Women aged 20 to 39 should receive a clinical breast examination every 3 years. Self breast examinations should be started at age 20. It is recommended to perform monthly after menstruation, or the same day every month for those who are postmenopausal. Diagnostic studies include mammography. This type of diagnostic tool creates images of the breast that can provide information on the size and character of the mass. Mammographies have saved a lot of lives because they're able to diagnose cancer before clients may be exhibiting any symptoms or able to palpate a mass. Other diagnostic studies include ultrasound. Ultrasounds can be used to determine if the area of concern is fluid-filled cyst or a solid mass. MRIs are useful in differentiating benign from malignant tissue, especially in women with dense breasts or scar tissue from previous surgeries. Biopsies can be used to diagnose, and there's several types. Fine needle aspiration, this is where cells are extracted from the mass. Core needle biopsy, this is performed using a wider needle to obtain a larger sample. Vacuum assisted biopsy, this is done using mammography imaging, ultrasound, or MRI to locate the mass. A biopsy probe is introduced through a small incision. The device pulls tissue through the probe, where a rotating cutting device removes the sample. Lastly, surgical excision. For masses that are less than 2.5 centimeters, the mass is usually removed entirely. For masses that are larger, a portion of the mass is removed for further evaluation. There are several benign conditions of the breast. The first one that we're going to talk about is mastalgia, or pain. It can either be cyclic or non-cyclic. Cyclic is associated with hormone changes during the menstrual cycle, whereas non-cyclic is not associated with the menstrual cycle. It could be caused by cysts or trauma. Less than 10% of women with breast cancer will present with any sort of pain. Next, there's palpable breast masses, or fibroadenoma. These are common and usually benign. They're usually movable and non-tender. However, all masses must be evaluated to rule out malignancy. There could be discharge from the nipple. A milky, non-bloody discharge from bilateral breasts aren't usually concerning. However, discharge or blood from one nipple needs further evaluation. Mastitis is the infection or inflammation of the breast tissue that is common in breastfeeding women. The most common causing organism is Staphylococcus aureus from the infant's mouth or throat. Risk factors for mastitis include history of mastitis with a previous infant, cracked and or sore nipples, using only one side for breastfeeding, wearing a tight-fitting bra, poor nutrition, ample milk supply with reduced number of feedings. Assessment findings include breast redness, tenderness, hardness, swelling, and warmth, malaise, pain or burning continuously while breastfeeding, and fever of 101 degrees Fahrenheit or greater. Interventions include oral antibiotics for 10 to 14 days, cold or warm compresses and analgesics, washing hands prior to breastfeeding, complete emptying of the breast, and good breastfeeding technique, and this includes having a proper latch while breastfeeding. Mastitis can lead to abscesses, which may require surgical incision and drainage. Gynecomastia is the enlargement of glandular tissue in male breast. It's often caused by an imbalance between estrogen and testosterone. It is common in various stages of life, often after birth, during puberty, and at midlife and beyond. Risk factors for gynecomastia include obesity, lack of proper nutrition, tumors in the testicles or adrenal glands, liver disease, hyperthyroidism, hypogonadism, kidney failure. Assessment includes breast pain or tenderness. Mammogram and ultrasound should be performed to rule out breast cancer. Often no treatment is required. Medications may be used to treat underlying medical conditions. Surgery is not typically recommended unless there is severe pain or tenderness. The client may require counseling. Another benign condition of the breast is fibrocystic breast. It is common for breasts to develop fibrous tissue and benign cysts. It often occurs in women between the ages of 20 and 50. It is usually caused by an imbalance of estrogen and progesterone. In the image, you will see A is a normal breast and B is a fibrocystic breast. Assessment includes cyclic bilateral breast pain, usually in the upper outer quadrants of the breast, increased engorgement and density of breast, fluctuating size of cystic areas. Women should be familiar with their breast, perform self-breast examinations, and monitor for any changes in their breast tissue. Treatment includes differentiating between fibrocystic changes and breast cancer. It's important to note that breast cancer is often found in the upper outer portion of the breast. Treatment is geared towards symptom relief, and this includes oral contraceptives, NSAIDs and Tylenol, wearing a supportive bra, avoiding caffeine, smoking, and alcohol, as well as heat application. This is the second voiceover for the breast disorders content, and will cover breast cancer. Breast cancer is the second most common cause of cancer-related deaths in women. There are many risk factors, which include being a female, although men can get breast cancer as well. Age, it's more common in people 55 years and older. Being African American, having a higher number of ovulation cycles in a lifetime. This is with early menarche and late menopause. Lack of pregnancy or first live childbirth after the age of 30. Having a family history of breast cancer. Having the BRCA1 or BRCA2 gene mutation. Benign cell changes such as hyperplasia. Having dense breast tissue. Excessive alcohol use and smoking. Inactivity and obesity, the use of hormones, and exposure to radiation. The 7 steps for healthy breasts include healthy weight, regular exercise, decreasing alcohol intake and no smoking, eating vegetables and maintaining a low-fat diet, knowing your family history, receiving clinical breast exams and mammographies, performing self-breast exams monthly, and receiving genetic testing. Clinical manifestations of breast cancer include a new mass or lump. The mass is often irregular shape. It's hard or firm. Fixed to underlying tissues and non-mobile. It's usually non-tender. The client may have nipple inversion or drainage. The client may have peeling, flaking, dimpling, pitting, reddened skin that may be warm to the touch and have thickened appearance. It resembles an orange peel. This is shown in the image. Palpable axillary lymph nodes may be present if the disease has spread. Some of these diagnostic tools were discussed in the first voiceover. These are mammography. This can be used to determine the tumor size, ultrasound, MRI, and biopsy of the mass. Other diagnostics include sentinel lymph node biopsy. This can help to determine the extent or stage of the cancer. The sentinel node is the first lymph node to which cancer cells travel if they have spread. They are typically found in the axilla. If the sentinel node biopsy is negative, it may not be necessary to perform an axillary lymph node dissection, and this often involves removing 20 to 40 lymph nodes. Other diagnostics include the presence of hormone receptor levels, as well as the presence of HER2/neu, and this determines the treatment options that are available to the client. Please refer to Hoffman Figure 65.1 and Table 65.1 for breast cancer staging. Stage 0 is non-invasive cancer or cancer in situ. Ductal carcinoma in situ means that the cancer has not invaded surrounding tissue. Paget's disease often only affects the nipple. Stages 1 through 4 is considered invasive cancer. There is infiltrating ductal carcinoma that affects the ducts, which are tubes that carry milk to the nipple. There's infiltrating lobular carcinoma, and this affects the lobules that are the milk-producing glands. And then there's inflammatory carcinoma. This is the rarest form of breast cancer, but the most aggressive. Treatment is determined by the stage of cancer. There are several surgery options. Lumpectomy or breast conservation surgery involves removing only the involved breast tissue and minimal surrounding margin with the best possible cosmetic preservation of the breast. It is an option in early stage disease or advanced disease that has been reduced by chemotherapy. It can be used in conjunction with adjuvant radiation and chemotherapy. A total mastectomy is removal of the entire breast and areola. Lymph nodes are left alone. This is often performed prophylactically. Modified radical mastectomy is removal of the entire breast tissue and axillary lymph nodes. It's an option in early stage disease or advanced disease that has been reduced by chemotherapy. It may or may not require adjuvant radiation. So image A will show a preoperative breast. You'll see the primary tumor in the bottom of the breast. In B, this is a lumpectomy. You'll just cut away the affected tissue and you want clean margins. And C is a modified radical mastectomy. This is where you remove the entire breast and axillary lymph nodes. Other treatment options include chemotherapy, radiation, either external beam or brachytherapy, hormone therapy, These drugs include tamoxifen, Evista, Arimidex, and Femara. These drugs are on your objectives page. And targeted therapy, and one of those drugs is Herceptin, also on your objectives page. Complications after surgery include wound infection and dehiscence, immobility issues such as DVT, pneumonia, etc., lymphedema, which is the disruption of lymph drainage from the arm. Other complications include side effects of chemotherapy. Remember, chemotherapy affects fast-growing cells. This causes clients to have hair loss, mouth ulcers, pancytopenia, etc. Side effects of radiation could include skin breakdown or pneumonitis.